Excellencies and distinguished delegates, the COVID-19 pandemic has cost the world economy $11.5 trillion, pushed an additional 163 million people into poverty, and disrupted achievements of the SDGs. Nearly 10 million children living in communities facing multiple deprivations do not receive the most basic vaccines every year. Their number has likely grown due to the pandemic. Reaching them with routine immunization is critical for equity, to support primary health care, and for global health security. Access to COVID-19 vaccines underpins achieving these goals and is the only way to avoid social and economic consequences and builds resistance. Gavi therefore calls on member states to, first, rebuild, safeguard, and strengthen routine immunization to avoid backsliding and secure progress to fight polio, measles, pneumonia, Ebola, and yellow fever, and strengthen pandemic preparedness. Secondly, remove export control measures and other transit issues hampering supply and movement of COVID-19 vaccines, the supplies and ingredients necessary to make them, and ensure their equitable distribution, prioritizing those most in need. Third, help urgently mobilize $1.6 billion additional dollars, as well as an additional $1 billion in cost sharing through domestic resources and multilateral development bank support by June, to ensure that at least 1.8 billion COVID-19 vaccines are secured and delivered to the 92 lower income economies by 2022. Fourth, share surplus COVID-19 vaccines with COVAX to ensure donations have the maximum benefit for countries with the most needs. And finally, to make sure that we support technology transfer through exchange of information and know-how between vaccine developers and manufacturers to scale up vaccine production, especially in developing countries. Thank you so much for your attention.